Hey YouTube, how you doing today? I came across a pretty interesting article and I kind of want to share it with you today. So I've seen this in a couple of places. I haven't seen it mass produced anywhere or shown to a lot of people that I can tell. So I figured I would just make a video on it and kind of show you what's up with it. There's two sides to the coin here on how you want to take it and what it really means. But we'll get into that in just a little bit. So basically, what I'm looking at right now in front of this screen is a study that's being done by USC and the County of Los Angeles Public Health. They're teaming up and taking samples from the population to test not if people have the virus that's out there during this pandemic right now, but if people have the antibodies to kill the virus. And so basically, what they're determining is how many people have had this virus before, and then determining how that correlates to what we've currently been confirming. When you confirm a test right now, we're only confirming whether or not someone has it at the time of which we test them. That doesn't do a strong correlation to how widespread the actual infection has been. And so USC and Los Angeles teamed up to test their population to determine how many people have had it and have healed from it. And so there's really only one paragraph that I really want to focus on, and it's this one right here. So what we're looking at is 863 adults. That's not very many in the entirety of the population of Los Angeles. Obviously, 863 is a very small sample size. So data may be skewed. They do take into accountability of that. But out of those 863 adults that they took, we have a 4.1% of the adult population with antibodies to the virus, meaning that 4.1% has been exposed and healed from it, or been exposed and had the unfortunate event of what happened. As far as having a deceased, at the time of this study, there were 600 people that have passed inside of the county. Rest in peace. This is very unfortunate. Nobody wants to have their life cut short, especially from something that should be preventable, because it's a disease and we have medical technology. But we have to come up with a vaccine, and that's what we're working on. That's the reason everybody's staying at home right now, is the fact that we don't want to have an influx of people going into a situation where we have to turn them away from hospitals because we don't have any more space. That's the reason that people are at home. So going back to this, we have 4.1% of the adult population having the antibody virus. What that kind of boils down to, they make a statistical margin of error to bring it down to 2.8 to 5.6%. So they're saying that a roughly good measure would be that a minimum amount of people would be 2.8%, which will then translate to 221,000 people, adults, to 442,000 adults who have had the infection altogether. Now, corresponding this, we have 221,000 to 442,000. I'm going to put those numbers at the top of the screen right now. That's the range in which they're saying they have the infection. If we go over to the Johns Hopkins University map, this is a very cool site. I'll put a link down below. It shows a lot of data as far as it says the total confirmed number in the world. And then I can't really show it. Let me throw my camera up here at the top. Then it goes on below here to state that, which country has the most infections. And of course, these numbers are only going to be done by how many people are actually being tested, because these are the confirmed cases that we were talking about. So, scrolling back over here, we're talking about 221,000 to 442,000 in the county of LA. So, with this map, you can scroll into the U.S., and from the U.S., you can see you have all the different counties in which someone has actually been confirmed. Now, as far as Los Angeles goes, I'm not one to sit here and tell you when these numbers were exactly confirmed. This says 20,000 right there. It's kind of hard to read. You can see it right here. It's about 20,000 people have had confirmed cases. At the time of this report and this posting, I'm not sure exactly what it was, but if we're doing the number of confirmed cases, the times when we actually test somebody and they are sick at the time of testing, we have about 20,000 confirmed cases. what this study is finding is that a minimum of 221,000 people have been exposed to the virus and have antibodies to fight the virus. Okay, so right here they go on to say that there were 8,000 confirmed cases at the time of the study in early April. So there were 8,000 confirmed cases, and at the time of the study there were 221,000 as a minimum. So that means that the estimation of how much is 28 to 55 times higher. That's insane. That is absolutely mind-boggling. So if we're only talking about an 8,000 confirmed cases, when we look over here and see 20,000 confirmed of people who have been tested and confirmed to have that at the time, you can see that it's doubled the amount, and then we've had 600 to 900, which is only going up by 150% instead of 200%. All in all, statistically, it seems very skewed that the disease itself doesn't kill at a super high rate. Again, if you're sick, stay home, don't spread it. We don't want to have people who are susceptible to get that disease, but I'm hoping that this video will show you the numbers that we were being presented and the amount of death to confirmed cases is actually a lot more separated. So 600 out of 8,000 is a lot different than 600 out of 221,000. I want to try and I want you to be smart in the pandemic. Obviously, don't try to get the disease. Don't go around doing the coronavirus challenge, which I don't know if I'm going to show a clip of that, but people are dumb. Don't be stupid. Try to be smart. Be respectful of others. Try not to put yourself in a situation where you could get the disease and then spread it to someone else. You obviously wouldn't want to have a loved one get it and have to fight it and have anything happen with it. That would be absolutely terrible. But I do want to try and give you a rest assured, like the amount of cases that are out there has been worse than what has been reported, but the death toll number is the same. So that would mean that the percentage of how many people are actually not recovering from it is smaller than what you think. And again, be smart, stay away, or social distance. Don't try to go out there. But I found this little article, this little study to be very interesting. And I wanted to share it with people just due to the fact that it's something that should be looked at from an entire population. And if we ever get to a point where we can actually have people tested to see whether or not they're okay, it would be in the best interest to have everybody do that, just in the fact that you would be able to, give yourself rest assured you have the antibodies, you're okay, you're going to be fine. But again, keep to the guidelines, make sure you're washing your hands, all that sort of stuff. I hope you have a wonderful day. Again, link in the description if you want to look at either of these. They'll be down there. This is just a press room from University of Southern California, and then the Johns Hopkins map over here. Super awesome tool if you want to look at data, and it will give you a type of thing. I like to come over here once a day and just watch these numbers go up. I've watched this go from 700,000 all the way up to 2,990,000. It's not necessarily the coolest thing for everybody, but as a nerd who likes data, this is super cool to look at. So anyway, guys, if you like this content, think about leaving a comment down below, a like, subscribe to the channel. That'd be super great. I will see you guys in the next one. And just so you know, you can click on each one of the counties and look. So this is Los Angeles County. You can look at what the population statistics are on everybody, and then they give you a whole bunch of different stuff down below on what's happening with it. So enjoy your freaking day. I'm out of here, and I will catch you in the next video. Bye, guys.